Hello, this is Dr. Praveen Ramachandra. I'm senior endocrinologist working in DiaPlus Endocrinology Clinic, Yelahanka, Newton, Bangalore, India. Please watch this video.
Welcome to today's Explainer. So, we're diving straight into a topic that affects literally millions of people around the world, but honestly, it's still so incredibly misunderstood. We're talking about managing age-related bilateral knee osteoarthritis. And I want to highlight right up front that this amazing patient education guide was put together by Dr. Praveen Ramachandra. He's a senior endocrinologist at the DiaPlus Endocrinology Clinic over in Yelahanka, Bangalore, India. We're going to take his clinical guidelines and distill them down into a super practical, non-medical toolkit that you can actually start using today. All right, here is our game plan for your empowered patient toolkit. First, we'll demystify knee away. Then, we build your core non-medical toolkit, figure out how to modify your daily lifestyle, look at assistive devices and therapies, cover the treatments you should strictly avoid, and finally build your very own personal action plan. Let's get into it. Okay, part 1, demystifying knee osteoarthritis. Let's talk about the actual realities of degenerative joint pain. First off, if you are experiencing this, you're absolutely not alone. It turns out a massive 70% of people dealing with knee osteoarthritis are over the age of 55. But the onset usually starts creeping in a bit earlier, right around the late 40s to mid 50s. Since it's such a common age-related condition, getting a handle on it early is just absolutely crucial to keeping you moving in the long run. And here is a really important piece of the puzzle. 60% of people managing osteoarthritis globally are women. So if you fall into this demographic, paying close attention to these preventative and management strategies isn't just a good idea. It's a vital step for protecting your overall health and independence. Now, we need to clear up a massive misconception right out of the gate. Osteoarthritis isn't just basic wear and tear from living a long life. It's actually a degenerative condition. It affects the entire joint and the tissues around it. And when we say bilateral, that simply means it's breaking down the joints in both knees, which brings on the pain, the swelling, that terrible stiffness, and a real drop in mobility. But hey, don't worry, because the clinical data is super clear. We have proven strategies to fight back. Moving right along to part 2, the core non-medical toolkit. These are your foundational strategies for finding real relief. Okay, so your instinct is probably telling you, my knee hurts, I should rest it, right? Well, actually, supervised exercises are strongly recommended over doing nothing at all. Strengthening your quads and hamstrings builds up the support system right around the knee. Then you've got aerobic and water-based exercises. These are fantastic because they improve your overall mobility while taking a ton of physical stress off the joint itself. Add in some neuromuscular training for balance and agility, and you're golden. The American Academy of Orthopedic Surgeons is super clear on this. You want to actively rebuild your joint support system through movement, not by sitting still. Next up is weight management. Now, I know whenever we talk about weight loss, it sounds so incredibly daunting, but here's the secret. You do not need to lose half your body weight to feel a massive difference. Achieving a sustained loss of just 5 to 10% of your body weight actually provides incredible clinical relief. Why is that? Well, obesity is a major risk factor because that extra load just grinds down the joints, and the metabolic changes create systemic inflammation. Drop just 5 to 10%, and you are taking a huge amount of pressure off those knees. Rounding out this core toolkit is self-management, which is strongly recommended. Basically, this is about empowering yourself. You need to learn physical and mental coping strategies, partner with your healthcare team to build a daily care plan tailored just for you, track your symptoms, and really understand your treatment options. Everyone's journey with this is totally unique, so an educated, personalized approach is absolutely your best weapon. All right, on to part 3, modifying your daily lifestyle. We're looking at practical changes, specifically highlighted for patients in India. To really protect those knees, the Indian Council of Medical Research Guidelines say we've got to rethink some common daily habits. You've got to proactively avoid squatting, stop sitting cross-legged on the floor, minimize climbing stairs whenever you can, and try not to stand for hours on end. All of those put a tremendous amount of mechanical stress right on the joints. Instead, the goal is to embrace reasonable, low-impact activity modifications. It's really just about tweaking how you move through your day to give your joints a much-needed break. Okay, part 4, assistive devices and therapies. Let's look at some supplementary tools for managing the pain. So using devices like canes or braces actually comes with a moderate recommendation because they can noticeably improve your daily function and dial down the pain. Walking aids are definitely recommended, especially if you're dealing with osteoarthritis in multiple joints. Then we have things like heat and cold therapy, TENS machines, massage, and acupuncture. Now, a quick heads up here. These have a limited recommendation. That just means they offer some really helpful supplementary relief, but they should be an add-on to your exercise routine, not a replacement for it. This brings us to part 5, and this is a big one. Treatments to strictly avoid. We want to save your time, your money, and your health. Look, there is a very strong medical consensus on what you should absolutely not do. The guidelines are crystal clear. Stay away from oral narcotics like tramadol and opioid painkillers. They come with nasty side effects, and frankly, they just aren't effective for this condition. You should also skip hyaluronic acid injections, arthroscopic lavage, and lateral wedge insoles. The data shows they just don't work. And finally, please be super cautious about unproven stem cell therapies or supplements like glucosamine. There's either no long-term benefit or just insufficient evidence, so do not waste your hard-earned money on them. And that brings us to our final section, part 6, your personal action plan. And crucially, knowing exactly when it's time to escalate your care. So, what should your actual daily action plan look like? Well, first, you gotta start slowly. Pick low-impact activities like swimming, cycling, or just walking, and slowly build up your endurance. Second, consistency is everything. It is way better to do steady daily movement than to push through an intense weekend workout that just leaves your joints angry and inflamed. Keep those joints moving to fight off muscle loss. And third, bring your diet and exercise together to maintain a healthy weight. It's the best way to literally take the weight off your knees. But, all this great advice brings up one huge, critical question that we have to answer in this explainer. When does this non-medical toolkit just run out? When do you actually need to start thinking about surgery? Well, according to the ICMR guidelines, you should really only escalate to surgery when you hit some very specific, severe red flags. We're talking about pain so bad it stops you from walking or taking the stairs. Or if you literally can't walk short distances without leaning on a cane or a walker constantly. Another red flag is needing strong painkillers on a regular long-term basis. Or if you're experiencing pain while you're just resting, day or night. And finally, if you develop a severe physical joint deformity. These are the clear signs that medical intervention is your next necessary step. So the biggest takeaway we want to leave you with today, and this echoes the World Health Organization and the fantastic patient education from Dr. Praveen Ramachandra, is this. Early diagnosis, paired with a solid treatment plan, is hands down the best way to slow this disease. Taking charge right now with the non-medical toolkit we just walked through is your absolute strongest defense. The science is undeniable here. Your joints respond directly to how you use them. So I'll leave you with this. What is the one proactive step you're going to take today to rewrite the future of your mobility?